At STL Health, we are committed to reducing the stigma related to mental health. By reducing stigma, we can reduce the barriers for people who are interested in seeking help but choose not to. We are always looking at innovative and adaptive ways of providing health care to our communities.
Awareness around mental health is extremely important. No different than any other medical condition. If you're not aware that you may be having symptoms or need help, you won't reach out for that.
We can't see it, you can't look at somebody and see their mental health struggles, and I think that's hard for our brains to wrap around the unknown.
On our community health needs assessment, suicide came up as one of the leading causes of death in Mesa County. It was really eye-opening, I think, as not only a hospital, but also as a community member, how great a need there is for that, specifically in our area. We are definitely making mental health a priority at St. Mary's. It is a strategic imperative of ours, not only to improve mental health, but to flourish.
Zero Suicide is an initiative. We're working on culture change, we're working on training confident, caring associates to be able to talk to people that are thinking about suicide, and also screen patients as well that come into our facility for care.
Unfortunately, in about 2015, we had a small cluster in one of our high schools. And in 2017, across our district, we had over 7 suicides. Since then, our county has consistently been one of the highest counties in the state of Colorado with death by suicide for adolescents. So it was an opportunity for us to really jump into action. My hopes working with our community partners is obviously a decrease in suicide attempts and hospitalization. But really, it's more than that. It's helping parents and community members understand that this is not a taboo conversation, that this is actually more of a normal conversation than we would like to admit, and that's okay.
I think that's something that's really been unique to our community. We do have a lot of partners that work together in order to go forward. With suicide prevention, that's really key.
It'd be nice to have a larger staff all working together towards zero suicide and start to see in 10 years that there's a downward trend for suicide losses. The power of collaboration is important in suicide prevention efforts is because it needs to be a public health community effort, and it needs to be a community issue that we all need to be working together to come up with ideas on how to make people aware, educate people, which all together will help prevent suicide.
This can just keep building and building like a wave and a ripple. I like that adage of if you want to change the world, start at home. So let's start changing it right here. Eventually that ripple will meet out to every person that we encounter.